In August this year, the Kampala Capital City Authority and the Ministry of Health launched a campaign to make Kampala a smoking-free environment.
We want to make sure that we can implement the Tobacco Control Act of 2016, especially the provision that is dealing with making Kampala smoke-free.
However, this is not the first time such a campaign has been launched. In May 2016, 8 months after the President assented to the Tobacco Control Act, Dr. Chris Baryomunsi, who then was the health minister, said people lighting up in bars, restaurants or hotels now face being fined 200,000 shillings or jailed for up to 2 months. In further anti-smoking measures, the government banned the sale of single cigarettes and tightened rules on labeling, advertising and selling tobacco to under 21s. But since its inception, no one has been jailed or even fined for public smoking. Some supermarkets still display cigarettes. I have been able to acquire myself a pack of Sportsman cigarettes here, and I want to move into this other supermarket to see if I can be able to get another pack of cigarettes on display and be able to buy it. Sebo Jevali. Payoko Sportsman. So in both of these two supermarkets I've been able to buy these 2 packs of cigarettes very easily, and of course they are also on display.
If you're selling tobacco products, you're supposed to have a cupboard that covers them, and then if someone wants to buy, then they'll just have to ask the shopkeeper whether they have the tobacco products, and if they do, then someone just pulls out maybe a price list and shows them that this is what we have and this is the cost of it.
Public smoking is also common nowadays. Whereas the law on tobacco control is in effect, its enforcement is still a challenge. A team of experts from the United Kingdom working with the Center for Tobacco Control in Africa, Makerere University School of Public Health, Ministry of Health, Uganda Revenue Authority and other government agencies will undertake a research study in Uganda worth 11 billion shillings to establish why some policies on the control of tobacco use have not been successful.
The areas we are talking about, 5.3, which is being able to monitor the tobacco industry, illicit trade and tax, go hand in hand. Taxation, or tobacco taxation for that matter, is one of the most cost-effective measure of the WHO FCTC.
The research, funded by Global Challenges Research Fund and UK Research and Innovation, specifically focuses on tobacco taxation, illicit trade in tobacco, and preventing tobacco industry interference in the study countries. Occasionally, the enforcement teams carry out successful operations. For example, in 2017, the police raided some pubs in Kampala and confiscated several shisha pots, smoking pipes, knives and marijuana. And in April this year, the Uganda Revenue Authority seized illegally imported cigarettes worth 1.6 billion shillings. But one of the major challenges towards regulation and control of tobacco use is that growing the crop fetches the country more money in tax revenue than any other activity in the agriculture sector. Out of the sector contribution in 2016, tobacco raised 18 billion shillings of the total 125 billion. But researchers advise that tobacco use is a public health threat that must be curtailed.
Cost of tobacco to the Ugandan Health Service very recently was estimated at $45 million US. And when you add in the loss of productivity, sickness absence, and some of the other costs from tobacco use, it rises to $126 million US per year. And that far outweighs the value of tobacco to the Ugandan economy. So it actually makes sense to look at that balance and say, have we got it right?
Uganda has tried all measures to regulate tobacco use, but some of them actually force dealers into illicit trade.
The high taxes discourage people from bringing the products into the country. The illicit traders find an opportunity to use ungazetted routes to bring in, because first of all there is demand which has been cut off by the high taxes.
It gives tobacco users a cheaper form of tobacco, and so it undermines our tobacco control efforts and keeps people using. It also reduces the revenue that governments can get from tobacco, and it also introduces criminality into local communities and countries.
According to the Uganda Revenue Authority, illicit trade costs the government about 2.5 billion shillings in tax revenue every year. The tobacco control focal person from the Health Ministry, Dr. Hafswa Lukwata, says they have now embarked on a campaign to educate the public about the dangers of tobacco.
We are not going to increase on the number of police who are going to be around, or increase on the number of environment officers or customs officers or what. No, it is a local thing. It's going to be done by me and you, by the public itself, by the members of the public themselves are the ones going to implement this law.
Use of tobacco products like cigarettes is a key risk factor for non-communicable diseases. 2 of every 3 deaths in the world are due to non-communicable diseases. And according to Uganda Cancer Institute, 25 of every 100 people presenting with lung cancer have used tobacco. Similarly, 16 of every 100 people suffering from oral cancer, 14 of every 100 people have stomach cancer, and another 13 have throat cancer because of using tobacco.
Shisha is a tobacco product. It's very harmful to health. In fact, if you use it regularly, it is very harmful. And you're right, people don't understand that. In fact, even in the UK, we still have an issue around particularly young people and shisha bars. They're not supposed to use the shisha indoors, but you do see some cases where that happens. And that's really important to try and enforce that. And you're trying to do that in Uganda.
The World Health Organization says tobacco is the only legal product that maims and kills half of its users when used exactly as intended by the manufacturer. And that is why they are urging for tough regulations.
What we need to do is we need to introduce a system that will enable us to track and trace tobacco from the manufacturer, so from the time when it's made, right through to where it's sold in shops. And you can do that in a number of ways. So you can introduce licenses, you can introduce little marks on tobacco packets so that they can be traced and followed, so that you know where each product actually ends up in the market. And by doing things like that, you can drive down the illicit tobacco trade. But it needs to be organised across countries, it needs to be organised across partners, so civil society as well as the Ministry of Finance and the Revenue Authority and the Ministry of Health. And it also needs to have intelligence sharing as well between these different groups.
The economic impact of using tobacco is enormous, especially for a family setting. And this is a simple explanation. The cheapest pack of cigarettes costs about 3,800 shillings. An addicted smoker told us that he consumes a pack a day, which means he will spend about 117,800 shillings a month.
We are going to get a generation where many people are addicted, and of course once there's an addiction, then the development goes down. People cannot concentrate in school, people cannot concentrate at their places of work, and worse so, it is the infections, it's the diseases that come.
For every $1 the government of Uganda reaps from the tobacco industry, it spends about $4 to treat patients or people who have suffered the side effects of the use of tobacco byproducts. It is estimated that 1.3 million adults use tobacco, and only 23 of every 100 youth aged between 13 to 15 use tobacco.
Our duty is to promote health, and therefore we do not have any regrets conducting research that will control the tobacco industry activity, because at the end of the day our aim is to promote health.
The researchers call for ratification of the illicit trade protocol.
We believe that Uganda should sign that protocol as soon as possible. It should ratify it, and then it can implement the measures that are needed to drive down the illicit trade.
Walter Mwesije, NTV.